Welcome to Accessibility Now, a podcast produced by the Statewide Independent Living Council of Georgia. I'm Matt Shedd. Today we start a series commemorating the 30th anniversary of SILCGA. You'll hear from Pat Puckett today, one of SILCGA's founding leaders and the organization's first executive director. She reflects on the early days of incorporation, key legislative wins, and what it really takes to move the needle for disability rights. This isn't just a story of one person's career, it's a story of how persistence, policy, and people intersect to create lasting impact. Here's Pat. So were you the original founder of SILCGA?
Well, I was on the advisory board for the Independent Living Council for a number of years. And then when the law changed that allowed independent living councils to become corporate entities, the board chair and Leanne Pendergrass, who at the time worked for the state VR agency as the independent living coordinator for the state, Abby Shirley was the board chair and Leanne was the staffer for the council. And those two together incorporated the SILC. And then when there was a job opening, I applied, and I have to tell you kind of a funny story. Abby was blind. And so I had told her that I was going to be wearing this emerald green suit to the interview. And as I was leaving, she said, "Pat, that is a beautiful suit." A beautiful green suit, I think she said. And the whole room just cracked up, because they knew it was a setup. But
Right.
anyway, yeah, so that was that was 30 years ago. September will be 30 years.
So that was when they created the position for you, was 30 years ago?
Well, it wasn't for me. I just happened to get the job.
Right.
But yeah.
Right.
Yeah.
Okay. When they
It
created the
was
position. So that was in 95.
Right.
Okay.
Right. Yes.
And then the council, the advisory board went back earlier than that?
Yes, the advisory board was in existence probably a decade before the law changed, and we were allowed then to become a nonprofit entity. And I think that Georgia was maybe the 5th state in the country. Leanne might remember for sure, but we either 5th or 6th state in the country to incorporate.
So thinking back to 1995, when it first incorporated and you were the first director, what were some of the things that you could do at that point that you couldn't have done under when it was an advisory board?
I think the biggest thing that we did in those early years was to educate people about consumer controlled organizations and what it would require to become a center for independent living. We also at that time had some resources available for local disability rights organizations, local disability led organizations to deliver some independent living services like home modifications. So we had some consumer controlled folks out there that were building ramps and helping people to get equipment and, some of those kind of things. So at the time, the council was in charge of all the Part B funds. And so I don't remember about how much that was, like maybe 400, 500,000, something like that. And so we basically did capacity building for those local groups to help them understand what the federal requirements were to become a center and the core services that you had to provide, independent living skills and advocacy and information and referral and, all of those things, that defined all of those things and help people decide what it is they wanted to prioritize in their local communities. We did a lot of training on peer support. And I think one of the most effective things we did is we defined peer support is this, peer support is not this. So it's things like peer support was not an excuse to develop to uh, find a boyfriend or a girlfriend. That's not what peer support is. Peer support is helping people get through rough times and learn how to advocate for themselves and how to deal with a state agency that was not going to provide vocational services unless they fought it. So we did a lot of training and education in those early years.
That's helpful to understand. So then what were some, when you're looking back on those early years, what were some victories where you thought you saw the silk kind of gaining momentum?
I think it was as the federal dollars became more available, we were much more ready because of those early years of training and education, much more ready to become centers for independent living. It's not an easy thing to find strong leadership when you are working with a lot of people who've never had much in the way of education or had much in the way of opportunity to learn how to lead and to learn how to manage. So it was a challenge to find good leadership in those early days. But I think the readiness that we had when federal dollars became available is one of the biggest achievements, I would say. The
Yeah.
capacity to deliver services is something we worked very hard on in those early years, and we were much more ready to receive the dollars from the feds and to do it right. One of the biggest things we ever did was the Georgia Healthcare Foundation, which is now Georgia Initiatives for Health, I think. There were 8 small nonprofits. The Silk, a company called Let's Get Together, which was the first applicant for a federal Center for Independent Living, the Center for Independent Living in Atlanta, Augusta, and Macon. So out of these 8 small nonprofits, 5 of us were disability organizations. And it was that advocacy and how this all came about is that I don't know if you're familiar with the history of the Blue Cross Blue Shield foundations across the country. Well, in the early 90s, I think it was, or maybe late 80s, the Blue Cross Blue Shield insurance companies decided to convert nonprofit to for-profits. The federal law states that you are to distribute the assets of the nonprofit to similar nonprofits. But in Georgia, and I think in many other places too, the General Assembly said, oh, no, you don't have to do that. You can keep your assets. So a law firm, Carr, Tab, and Pope, was interested in finding people who would object to that. And so our 8 little nonprofits joined this class action lawsuit against the insurance commissioner of the state of Georgia, and I think also the attorney general, maybe. I can't remember who we sued, but anyway, through a long process of negotiations, the Blues in Georgia agreed to put X amount of assets, and I can't remember how much it was. It seems like to me it was maybe like 169 million into this foundation. And so in the negotiations process, the board of directors for this initial nonprofit included 3 people from the plaintiff group, 3 people from the Blues, and 3 people from just the community. And so that initial board then started making health projects. And the most interesting thing is when it changed its name from the Georgia Health Foundation to Georgia Health Initiatives, one of their big deals was to fund advocacy. And that was a big difference. I mean, this has happened in the last 5 or 6 years, I think. That was a big difference in the initial foundation, which funded health projects like community health centers, and they, tried to work in communities that were uh, not well served by the health system.
Mm-hmm.
Like they funded Morehouse School of Medicine and, some of those things to like work on things that were health disparities, basically, but didn't fund advocacy for all those years. And now they do. So that's because of the newer director. So the initial guy retired, and then they hired this woman who understands social change and understands advocacy. So to me, that is one of the biggest accomplishments for the Independent Living Network, to have been a part of that, and to have I don't know how many millions of dollars have been given away in the 25 years or so since we did that work, but a lot, a
Wow.
lot. So that to me is the biggest accomplishment of the Independent Living Network, was that. And as a consequence of that, the SILC received uh, several grants from Georgia Health Foundation to start some initiatives. So, like, for example, Georgians for a Healthy Future. I don't know if you might want to look them up on the
Mm-hmm.
website. I guess they still exist. Um, and that was basically some social change work, advocacy work. That was one of the few things that they funded to try to promote the idea of expanding Medicaid in Georgia, which didn't work. So that was one project, was Georgians for a Healthy Future. And then another project is Georgia Health News, which
Right.
are you familiar with
I
them?
am, yeah.
Andy Miller worked for the Atlanta Journal-Constitution for many years, and
Okay.
did major exposés on the mental health system, and really exposed a lot of discriminatory stuff on the part of our state Medicaid agency.
Okay.
So we helped them get started. We helped both of those organizations get started, and we did that because Georgia Health Foundation funded us to to help them get their nonprofit status and all that. And then as soon as they were up and running, we turned over the grant dollars to them, minus an 8% administrative fee. So we were about the only place that Georgia Health Foundation could go to that would agree to do that for such a low cost.
Wow.
So that's the other big deal that we've done, is it was basically health policy was our kind of thing, at the time.
Mm-hmm.
And we've made some significant inroads in exposing, I mean, through Andy Miller and through the Georgia Health, or the Georgians for a Healthy Future, significant inroads in exposing the world of discriminatory health policy. And then, we continue to do sponsored projects. That's what we call these things. We're sponsored projects through other grant making efforts.
Mm.
So, like, I don't know if you're familiar with Concrete Change, Eleanor Smith's work.
Oh, no, I'm not.
Okay, well, if you go, it's now housed out of the Center for Independent Living in Wisconsin,
Okay.
but the Concrete Change started um, a national movement, really, to change the way houses are built. So it's three very simple things. 1 0-step entry, wider interior doorways, and at least a half bath on the main floor.
Okay.
So that makes a house visitable by wheelchair users. And so there have been thousands of homes across the
Mm.
country built with those three things in mind. And how it's been accomplished primarily is through local ordinances. The first place that uh, did this was in the city of Atlanta, and there's a neighborhood right now that's got those features. And how Eleanor did that is she worked with oh gosh, what was her name? Myrtle Davis, who was on the city council at the time. And what they did is they waived the impact fees, and I don't even understand what an impact fee is, but for builders who would agree to build like this, they waived the impact fees. The
Hmm.
city did. So that got the neighborhood that I'm describing accomplished. So the same thing happened in Austin, Texas, in Bolingbrook, Illinois, and I don't know how many other communities. But if you go to the website Concrete Change, you'll see. So and how that's relevant is the State University of New York uh, had an architectural school, and he hooked up with Eleanor and then routed grant money through us to her because she wasn't incorporated.
Hmm.
So we funded her work to do that kind of work all over the country.
Hmm.
So that's
Wow.
another example of a sponsored project having lasting impact.
And what do you think you've seen in terms of the public sentiment and ideas about disabilities? How has that progressed since you first started in that role 30 years ago, and advocacy efforts, just generally like an overview of how things have progressed or not changed or regressed, or what have you seen?
Well, I've seen a lot more work opportunities, not just because of the silk, but because of companies out there that decided to use some of the VR resources, um, private nonprofits and private for-profits, to put people to work, of course, and just general accessibility and visibility on account of the Americans with Disabilities Act. That to me, that was that law generated uh, a healthier attitude about disability for the people themselves, for one thing, and from the on the part of the general public being aware of accessibility requirements and interpreter services and reader services and all those things. It's just the concept of reasonable accommodations uh, came out of the ADA, and that reinforced a lot of the push toward employment and push toward integration. And of course, one of the biggest things that was born in the Center for Independent Living in Atlanta was the Olmstead decision. That, in fact, I think if I had to say a victory that I had a definite role in, it would be that one. Because we did a roundtable discussion with attorneys. And one of them was Sue Jameson that worked for Atlanta Legal Aid, and a man named Mike Galifianakis, and he was the ADA coordinator for the state until he retired. But he was in that meeting. And then we brought two attorneys from uh, PILCOP, and I'm going to have to try to remember what that stands for, but I think it's the Pennsylvania. There were two attorneys from Philadelphia. So we brought Philadelphia lawyers to Atlanta, and we had this roundtable discussion about what can we do that would help get people out of nursing homes and into the community. And so Atlanta Legal Aid was kind of the lead on that for Georgia. And then a law firm in DC is actually who brought the case to the Supreme Court. And I got to be, my sister's a law librarian, and she knew the law librarian at the court. And so I got a ticket, which is a rare thing, to watch the case be argued in front of the Supreme Court.
Wow.
So that was one of the most delightful and exciting days in my career that I can remember.
So, for those who might not be familiar, can you kind of summarize like what exactly was solidified with the Olmstead Act?
basically the right to home and community-based services. That segregating people in nursing homes was a discrimination, was basically discrimination. And so the decision was people with disabilities must be served in the most integrated setting. Not the most integrated setting available, but the most integrated setting. So states all over the country, as a consequence, have developed their home and community-based services programs. So many, many more people, at least today, live in their own homes on account of that Supreme Court decision. Now, we have the current Congress saying they're going to cut $800 million out of the Medicaid budget. So the fight for that right that the Supreme Court gave us is going to be brutal. Just brutal, if they get their way.
How long were you in that role of director? When did you step down?
95 to 2015.
Okay. So 20 years.
Mm-hmm.
During your 20-year tenure, was there a particular, would you say, going along with what you just said about the Olmstead Act, would you say housing was a primary focus, or maybe transportation or medical care, or was there a focus, or was it kind of an all,
I think we worked primarily on home and community-based services. There was a coalition called the Unlock the Waiting List campaign, and that was led by Grace Fricks. This was many years ago, and all that was about growing the budget in Georgia for home and community-based services across all groups: aging, intellectual disabilities, and physical disabilities. So we kept up with what the waiting lists were for all of the Medicaid waiver programs, and we advocated for that. And it was just a pretty strong advocacy effort. There are always people at the Capitol working on the budgets. And that, to me, has always been what I care most about, is where is the money? I mean, I remember looking at budgets, in those early years, and the required adjustments for like cost of living increases and stuff like that for the institutions would eat up $34 million just to keep the doors open of those institutions. And then we would have, maybe $1 million, $1.5 million to develop community services. So it was very, in those early years, it was very institutionally oriented. And watching institutions like what was then known as Georgia Retardation Center in Atlanta, that closed. And, a lot of the mental health facilities have been closed, and people are supported in their communities now. So that was always my focus, mostly was the budget.
I see. Yeah.
Getting money for the right stuff.
Mm-hmm. So if you were to talk about some of the big lessons that you've learned, or that you learned when you were actively advocating for 20 years in the director role, what would you say were some of the big takeaways?
Well, I think persistence is one of the things you really have to do. You have to be very doggedly persistent and focused on making a change. And, like I said, my focus was always on where is the money and how can we get the money away from these segregated places into integrated places. And so that was always my focus. And then, the other one was to keep your spirits up by spending time with people who've benefited. So I think those are two big takeaways.
Thank you for listening to Accessibility Now, a podcast produced by the Statewide Independent Living Council of Georgia. I'm Matt Shedd, reminding you that a Georgia that includes everyone is better for all of us.